we are talking a lot about these multi-level influences, and so it makes sense that the solutions or the interventions will also be multi-level. So there's a lot of information that we looked at. There's a lot of things going on to address, but I wanted to focus in on mental health, specifically child mental health of Black youth. And so when we're looking at this, taking it from the societal standpoint, are there universal laws that are in place and policies to continuously fund community mental health centers? Are there universal mental health screenings in schools and in doctors' offices, really trying to meet families where they're at? Are we critically looking at the laws that are already in place that are discriminatory, and how can we change those to be more equitable for all people? And then at the community level, what supports are already available in your community? Are there funding for community mental health programs, funding for school-based psychological services, again, wanting to meet families where they're at? Is there a school psychologist that can pull a kiddo aside and do some brief intervention if they're noticing that they're struggling with something? And then taking it a step further in to the family level. Parents and many adults on this call, I'm sure we all have people, young people that are in our lives, whether it be kids or family members that we have influence over. Are we doing mental health check-ins with them? Are mental health conversations a regular part of your household and a norm in your household? Especially for Black and Brown children? Are you having conversations with them about their identity, about their racial identity, about what that looks like living here in America? Those types of conversations are known to help foster self-esteem and a sense of pride in who they are, which is linked to positive mental health outcomes. Kids generally learn through observation. And so as an adult in the household, are you setting a good example of self-care? Are you engaging in family value-based activities, whether that be family meal times or physical activity, going to the park, seeking social and tangible support from your other family members and community family members? Again, we know that social support is super uh, big and important in Black and Brown communities and is linked to improved outcomes. And then on the personal level, thinking about the kids, are they engaging in their own value-based activities? We know that things are beginning to open up a little bit more. Are they hanging out with their friends, either virtually or in person, whichever way is safe for them? Are they engaging in their own things that bring them joy? Are they learning ways to check in with their own mental health and kind of noticing changes in that? And if they are, do they have people around them that they feel comfortable reaching out to for support? Do they have access to mental health mobile applications or books or even engaging in therapy? These are just some of the ideas that we've come up with to support child mental health at the different levels. And we put together this graphic that is huge with lots of recommendations across all levels for a lot of the findings that we found in our paper. And we're not going to show that today, but we will link it either where this Embrace Race webinar will be or on our lab website. This is just a little snippet of what a multi-level intervention may look like to support child mental health.
Thank you so much.